Welcome to this webinar, which is arranged here in Stockholm today, but which is part of the Almedalen Week. I think we all would have liked to be in Visby today with the sun shining, but we will have to do as well as we can on this, given the fact that we are living under COVID restrictions. And what could be more interesting to discuss a day like today, also giving the circumstances of the COVID, but the issue of COVID more globally, and how we can address those issues more, how we have addressed them and how we can address them in the future. Situation is grave. I looked on the statistics as it stand from the European Centre for Disease Prevention and Control, and since 2019, 179 million people globally have been affected by COVID, and 4 million have died. And probably there is many more that has not been reported. So that is the reality, and I think there is a general understanding that in order to be able to overcome this pandemic, there needs to be more cooperation, and it needs to be addressed globally. And these are issues that we will have the opportunity to discuss today. We have a distinguished panel, and that consists of Carl Bildt, former Swedish Prime Minister, former Minister for Foreign Affairs, but right now, Special Envoy for the access of COVID tools, the ACT Accelerator, I think it's called, and that falls under the WHO. We also have Koen Doens, who is the Director General of International Partnership in the Commission, and who is very much in the center of the European Commission's efforts, or rather say the European Union's efforts in helping to address the issues that are related with the pandemic. And we have Anders Nordström, former acting Director General of WHO, former Director General of the Swedish International Development Agency, and most recently head of the Secretariat of the International Independent Panel for the Pandemic Preparedness and Response, the panel that was led by the former New Zealand Prime Minister and also former Director General of UNDP, Helen Clark, and the former President of Liberia, Ellen Johnson. So the way we will do it is that the panelists will start up by giving an introduction, and then we're going to have a discussion between the panelists on the issues. So without further ado, I hand over the floor to Carl Bildt, please.
Thanks, Christian, and nice to see you digitally. It would have been nicer, as you said, in Visby, but we are where we are. Let me start with just a quote. The world is at acute risk for devastating regional or global disease epidemics or pandemics that not only would cause widespread loss of life, but upend economies and create social chaos. End of quote. Those were the words of the report by something called the Global Preparedness Monitoring Panel that was issued in November of 2019. Nearly 2 decades ago, if we go back in time, the SARS coronavirus, it raged for 6 months. It affected 29 countries. It killed 774 people. It was something of a global wake-up call, or should have been. Because in the subsequent years, with H1N1, with Ebola, with MERS, among others, no less than 11 high-level panels issued 16 different reports with recommendations on how we should increase our preparedness in a new age of pandemics, which we evidently had entered. And the Global Preparedness Monitoring Board was set up by the WHO and by the World Bank to monitor how the different parts of the world were preparing themselves. But the brutal fact was that very few of the recommendations were acted upon, and few of the reports were read outside the circle of the already convinced. I have to confess, I didn't read them. The rest, as they say, is history. Looking back, and Anders Nordström and the independent panel has done interesting study on that, I would say that at the onset of this pandemic, China lost 2 weeks when it should have acted faster after the new coronavirus virus had been detected and sequenced. And the world lost 2 months when it should have acted far faster after the WHO on January 30 declared what it called a public health emergency of international concern. That's the highest warning designation that is available in the arsenal of the WHO. All red lights were flashing. But it was only really in April when things started to happen. Act A, and I'm the special envoy of the World Health Organization trying to coordinate its work, was set up late April, 85 days after that declaration by the WHO. It was a framework designed to accelerate and coordinate the efforts of all the key actors in providing, with the 3 pillars, diagnostics, treatments, and vaccines. And part of its vaccine pillar is the COVAX Facility that is supposed to help the low and medium income countries with access to vaccines. If we look at what's been happening since then, and I'm quite certain that Anders will have his views and take on this, it is a slightly mixed record. I would argue it's a story of the success of global science and the failure of global politics. The first vaccines were ready for clinical trial in under a month, with safe and effective vaccines available after more 307 days. It was an incredible achievement, given that novel vaccines often take up to 15 years to develop. And for some common infectious diseases, we still struggle to come up with vaccines at all. And today there are 8 vaccines given the green light by the WHO, twice as many offered in different countries around the world. And there are now, latest count, 102 vaccine candidates undergoing clinical trials. That's a tremendous success of science. But politics is a slightly different issue, and I restrict myself to the global level. There is an understanding in general terms that no one is safe until everyone is safe. As long as the pandemic rages, there remains an acute risk that new mutations and variations might appear, complicate the situation further, and at worst, start rolling back what has already been done. And as far as the economy goes, Kristalina Georgieva of IMF has underlined that today pandemic policy is the most important economic policy. The calculations of the IMF shows that an investment of roughly $50 billion in diagnostics, vaccines, and treatments would bring an improvement in the global economy of roughly $9 trillion, including, by the way, an increase in the tax income of high-income countries of around $1 trillion. Every finance minister would scream with joy over that. Few investments are as profitable as that. But in spite of that, I would have to say that, for example, the outcome of the recent meetings of the G7 was disappointing. There was no further commitment of resources to bring the immediate funding gap of roughly $16 billion that have been identified by Act A, and commitments of vaccine dose sharing, which is acutely necessary, that fell distinctly short of what had been identified as necessary. So it is an uphill struggle. Global reported cases were declining for 8 weeks. It is now leveled off. That's good, semi-good news. But if you look at figures from Latin America, in particular Africa, but also certain countries in Asia, you see steep increases. Russia, nearby us, that's the most worrying story. In Europe, the Delta variation that emerged first with such devastating force in India is now very rapidly gaining ground. It's only been identified in 85 countries around the world. And I'm going into science, which I'm not an expert on. I would be fairly certain that it's not the last variant of concern, as is the official term, that will emerge. I see new there's a variation called Lambda, first identified in Peru, which looks like very complicated in Latin America at the moment. And globally, we should be aware of the figures. Only 15% of the population has had any sort of vaccination. And the overwhelming number of those, of course, in a fairly small number of high-income countries. And to bring the pandemic to an end, there's a need to vaccinate roughly 70% of the global population until next summer. And this will require in the order of 11 billion doses of vaccine. We have a long way to go. There's an unprecedented effort underway to increase production. The normal annual production is sort of 3-4 billion doses. That's for sort of ordinary infections of these different sources. They are to a large extent still needed. But here we need, of course, to increase production enormously. And there's numerous hurdles. It's a complicated process. Just one example, the Pfizer-BioNTech vaccine requires 280 inputs coming from suppliers in 19 countries. There has been struck more than 200 technology transfer agreements to facilitate increases in production. That's an unprecedented number. But trade restructuring or trade restrictions and different forms of vaccine nationalism remains a key problem. The WTO, the World Trade Organization, the other day noted that while the number of trade restrictions affecting vaccines have come down from over 100 at the beginning of the pandemic, there are still 53 identified trade restrictions that slow down the necessary increase in vaccine production. And then there's, of course, the need for diagnostics. We can't fly blind. That is what is happening at the moment, for example, in Africa, as well as treatments. We saw the oxygen crisis of India. That must not be repeated in Latin America and in Africa. And when we, at some point in time, start to see the end phase of the pandemics, we should, of course, sit down, learn the lessons, and draw policy conclusions for the future. The independent review has given us a lot of things to think about. We have a strategic review of the Act A that is supposed to be ready for the G20 summit in October. In November, there will be a special session of the World Health Assembly that will start to consider the initiative of negotiating what is called a pandemic treaty, and a number of reports coming out of the G7 as well that are useful. But at the moment, I would argue, our full attention must be on fighting the fight that we are in. Is all of us, independent of other political disputes we might have in the world, against the virus that is spreading, changing, adapting, and evolving. And as I said, 85% of the global population has had no vaccine whatsoever so far. But looking forward briefly, as said, so far, a very impressive scientific success and a political failure in fighting it. And let's be clear, we might have been lucky this time. I mentioned SARS in 2003. That was significantly more deadly. COVID-19 is significantly more contagious. This is not the last coronavirus. We can't exclude, as a matter of fact, we must be prepared for the advent of a coronavirus that might be as contagious as we now see with the Delta variation, and could be as deadly as SARS was. That could be, as someone has said, a truly civilization-shattering event. So in the middle of fighting now, a fight which we haven't won yet, we must be prepared for something that might be even more complicated further down the road. Thanks.
Thank you, Carl, and thank you for this very substantial intervention or presentation. It is, on the one hand, alarming what you say in terms of the political failure, but it's reassuring that that science has been able to deliver to the extent they have. And I think we would be interesting to come back to the political failure and discuss a bit what that calls for the future. But before we do that, Anders, please, you just have delivered or been part of delivering this report, so please go ahead.
No, thank you very much, Christian. And as Carl obviously has read our report very carefully, you covered quite a lot of our findings. That will allow me actually also to look back. As you said, looking back at the SARS, in 2006, I was attending the G8 meeting in St. Petersburg. I was the acting director general then for WHO. Then President Bush took me to the Chinese president and pointed at me and said, "This is the health man. You better share with him if you have an outbreak of a disease." This was in 2006. They didn't know who I was, of course. But that was already at the agenda at that time. So the first finding of our report, this was a report produced by a panel, as you said, Christian, chaired by President Sirleaf from Liberia and Helen Clark from New Zealand, and with 11 panelists, 2 of them from Europe, as we now are within the European context. It was Michelle Kashachkin and David Miliband, who quite a few of you know who they are. So 13 very dedicated people. The first finding was exactly what Carl said. The world was not prepared. And this was despite both warnings, like from the Global Preparedness Monitoring Board, but also despite the ranking system that we had to assess countries' readiness or not. The US came out as #1 on this ranking, but they didn't do as sort of at the top of when we looked across countries across the world. So the world was not prepared, no question about that. The second one was then, again, a little bit like you said, Carl, that the present system for sharing information and alarming, the alarm bell, did not work. So the present system we have called the International Health Regulation, it's too slow. The virus moves much quicker. And what is now put in terms of requirements on the Director General for WHO is basically slowing things down. So when the Director General of WHO rang the bell on the 30th of January, no one reacted. And as you said, it was not until he used the word pandemic on the 17th of March that people began to react, or when the hospitals filled up in Italy that people realized that this is real, but that was too late. So the third finding of the panel was that some countries actually got it right, and we need to learn from them. And those were a few of the Asian countries: South Korea, Thailand, Singapore, who applied what we called an aggressive containment strategy, rapidly identifying the cases, isolating them, testing them, ensure that you stop the transmission, but without closing down the societies, but with a sort of a surgical approach, and that worked. And then you had on the other aspect, or so to speak, end of the spectrum, we did 28 country studies. Then you had the countries that totally just denied that this exists, denied science, and there, of course, you had the US and Brazil. But then we had a number of countries in the middle, and unfortunately, very many of the European countries were there. They took a wait-and-see approach, and they thought that our robust and very solid health systems will cope with this. We will manage, and that has proven was not possibly the best strategy. And the last and fourth, simplifying this a bit, finding of the panel was that the international system did not function as a system and was not fit to deal with this kind of crisis. We have an international system that can deal with political crises, with wars, with other big threats, but big health threats of this magnitude, the system is not geared up to. And WHO was not equipped, neither have the right authority or the right financing to be able to do what was expected from them. So what we concluded from the panel in terms of looking forward, in terms of the recommendations, and then 100% in line with what Carl said in terms of we have an emergency, we have a crisis now. The most important is to deal with this now. Make sure that we redistribute the vaccines that are available. There is quite a lot of vaccines available. Only within the European Union countries, the latest figure I saw, there is 2.5 billion doses available for 470 million citizens. And if we are only immunizing 70%, there's quite a lot. Even if we give everybody 3 shots, there's plenty that can be redistributed. So there is need for action now to move the vaccines where the vaccines are needed. Plus then investing in the manufacturer capacity. And we begin now to see signs that things are happening in South Africa, in Senegal, in Rwanda, which is really good, but it will take time. So it's not, we can't wait for that. We basically need now to move the vaccines that are available. But we need to do more than that. I'm deeply worried about the situation in Africa right now because it is exploding. I was talking to President Sirleaf just the other day. The hospitals are full. There is no oxygen available in Liberia and Uganda and Zambia. It's becoming the Indian situation now. So it's a really, really big worry. That has not really made the headlines here yet. For the future, the panel is clear about that there is a need for a reset of the international system at large. We need a different way of tackling and preparing for this kind of crisis. That, again, as Carl said, we will see again. And we will most likely see something that is more dangerous than what we have seen now. And then we need to be prepared. So the first recommendation from the panel for the future is, and this is not in line with Carl, then I disagree, that countries need to invest in preparedness now. You can't wait. I was the head of the WHO country office in Sierra Leone during the Ebola outbreak. We had active Ebola in 3 districts. At the same time, we build the system for the future. It's now. If you wait until this is over, no one will care. So one needs to get countries, including Sweden, to invest in preparedness now, to look at your capacity, your organization, etc. Don't wait. Second recommendation is that we need a different kind of surveillance and alert system. You need to authorize WHO to publish information immediately without getting the approval from the country of concern, which is the case today. You need to have a pre-negotiated agreement with WHO to be able to dispatch expert missions immediately. Sweden should say loud and clear, we would like WHO to come to Sweden if something happened here, so that other countries will follow. We need to have that pre-negotiated. But we need also a surveillance system that is based, of course, on digital technology, using big data to be able to project. Today we have, and we made that as one of our sort of statements from the panel, we're living in a digital world, but we're using an analog system. In terms of the platform, the Act A that Carl is engaged in, correct, that science was very successful, but for the future we need a system that is not just producing science and vaccines, but is also connecting that to production, to financing, which did neither work 100% well, and to an effective allocation mechanism. And this is one of the big challenges here now, and I hope we can speak more about that, that this is no longer about development and low and sort of the poorest countries of the world. This is all countries. And to have a modality that is basically dealing with all countries across the world, this is something new. This is which some of us call a global public goods sort of approach that we need to take. So how do we deal with that? That includes both high-income countries, low-income countries, and middle-income countries in the same framework. Some say we can't, we need to separate. I don't think so, because this has to do where are we then able then to immunize people. And we need a different platform that are looking across the whole world at the same time. Not easy, but that's, I think, is for the future. And the same thing for our 5th recommendations, which is about finance. There is a need not just for more money, but more rapidly available money, and also different kind of money, no longer aid. This is about investing in global health, security, and stability. So we need to have access to Minister of Finance directly, possibly based on some sort of formula across the world, possibly doing something with IMF. But we need a different kind of way of financing global health security. And today we are thinking aid, and that's too narrow, both because of the scope, but also in terms of the resources. Finally, there is also a need, as was said, not just for science, but for politics. And the panel is very clear that what was done then after that report that was referred to when the Global Preparedness Monitoring Board was established. That was established based on a report that President Kikwete from Tanzania led, and he recommended then a high-level political body. The Secretary General didn't approve, WHO didn't approve, and instead they established the Global Preparedness Monitoring Board. This panel recommends a Global Health Threats Council established by the United Nations General Assembly at the highest possible level, both with heads of states or former heads of states, also with private sector leaders and civil society leaders, to take the political responsibility, to ensure that there is accountability in the system and that there is real, true multilateral responsibilities when something is happening. So what we are looking forward now as next steps, continuing work with WHO, moving towards potentially a global pandemic framework convention, a treaty. But also, we are briefing the General Assembly now on the 20th of July, a political declaration, a political agreement in New York, so that the panel's recommendations are not just the panel's recommendations left at the shelf, but is really becoming politically agreed. So that is what we hope for that will happen during the fall. Thank you.
Thank you, Anders. And Koen, I think there are a number of issues which are interesting to listen to your reflections. I was thinking of one, but I mean there are others, Koen, I'm sure. It is the issue of how to get the resources and how to be able to muster the necessary assets that are called for in order to help countries in Africa in particular, but more broadly to fight this pandemic. So Koen, you have been in the center, You were, as I said, the man behind what is now Team Europe. And so very interesting to listen to your comments. Please go ahead.
Well, thanks a lot. Thanks a lot, Christian, and really good to be here with Carl and Anders. Maybe also a few general comments first, because I mean it's impossible not to recognize what a roller coaster this has been. I think for all of us, and it's sure, as was said, that this was something of a scale that no one was prepared for. And I think it's normal to recognize that when such a thing happens and rolls out across the globe, that it exerts huge pressure on politicians, and that politics has indeed struggled to deal with this. And what happens when politics struggle? I mean, it's what I call the Tolstoy paradigm. From the opening lines of Anna Karenina, which is that all happy families are alike, but each unhappy family is unhappy in its own way. And I think that that's what we've seen, is how, whether we talk about authoritarian regimes or democratic regimes, we've all been struggling with this in a different way. And that has indeed led to a situation where some things have been done well, and others not at all. And I think that, I mean, as Carl said, definitely science has done a tremendous job, but it was helped by politics. I mean, the investments that have been made, the funding that was provided at a large scale to allow science to do its job, to allow pharmaceutical companies as well to develop the vaccines at a higher speed than was ever done before, is also partially the making of politics gone well and not gone wrong. But I would certainly not contest the fact that there is a significant scope for improvement for many of the other things. And that especially now, I mean, much more needs to be done. What Europe has done in the first phase, and I won't expand, I won't take too much time to set out what we've tried to do, if not well, then at least partially well, was I do think we've rallied right from the start in April 2020. Christian, you were still there with us, to mobilize all the money we could find in our different parts of the system, both the EU and our EU member states. That's when we invented Team Europe, to mobilize very quickly 40 billion euros. And that was no minor feat, I think, to be able to address the immediate humanitarian challenges, the immediate health challenges, and let's not forget the huge socio-economic impact that COVID has had. It has wrecked socio-economic systems in our partner countries massively. Just think of a country of which the economy depends on tourism. I mean, it's been quite a tsunami that they've been held with. On the health front, moreover, and I think we still pride ourselves of that, the milestone was really this coronavirus global response pledging marathon, which President von der Leyen really put her shoulders under, following the launch of ACTA and the COVAX pillar, a marathon which raised 15.9 billion euros, 75% of which was, by the way, raised in Team Europe. So I think that there has been an attempt to immediate, sizable responsiveness to what happened. And we continue to try to do that. I mean, Team Europe is one of the biggest, if not the biggest funder of COVAX, with over 3 billion euros pledged. And we are, it's not always said, but we are the #1 exporter of COVID-19 vaccine in the world. I mean, 50% of the vaccines produced in the EU are being exported to more than 90 countries across the globe, including COVAX. There is no other part of the world that produces vaccines that can put down those kind of statistics. Is that enough? No, but it is certainly a step in the right direction. Which brings me to what needs to be done more. I think, first of all, as both of you have said, I mean, the financing gaps for ACTA remain. COVAX, thanks to the successful pledging conference in June, organized by Japan, has now covered its financial needs for this year, not for 2022, but at least for 2021, even if, I must insist, between pledges and payments, there is a gap. And I think for us, this is a real priority. It's not enough to pledge money. You actually need to pay it, because unless you pay it, COVAX cannot buy anything with it. But it's not just the COVAX pillar. There are the other three pillars of ACTA, which require funding as well. And there I think we really need to look at how we're going to plug those funding gaps. I mean, ACTA is launching a strategic review. I think that will be very useful to look at what was achieved, what can be approved, but definitely funding for these other pillars is a critical priority. The second one is, of course, dose sharing. I mean, you can put all the money in the world into ACTA. If ultimately they can't buy vaccines with it, it's no use. And I think there have been attempts, EU level, G7 commitments to show the way forward. I hope that these commitments can now be quickly operationalized, and obviously that more can be done. By the way, I know Sweden has just decided to donate 3 million doses through COVAX, which is certainly welcome. If you look at the amounts of money COVAX has and the limits to what it can roll out, it is because of the issue of access to doses. Of course, I mean, especially you, Carl, you've been Prime Minister. You know that in democracies, this is putting our leaders to test, squeezing them between global solidarity, the right thing to do, as you say, nobody's safe unless everyone is safe, and of course the pressures in democratic systems on the governments by their own population. So I think it is not an easy balancing act, but I do hope that we can get to a breakthrough when it comes to more sizable sharing of vaccines. Brings me to my third point, and here I fully agree with what Anders has said. It's on top of our agenda. It's strengthening country readiness and strengthening health systems. And like you, our experience with Ebola and with previous pandemics has been that if you deal with a pandemic, use the opportunity to strengthen the health systems, because that opportunity in a situation when we're all on red alert does not repeat itself. And it is fundamental. We've all seen when a pandemic hits, the first line of impact, the first capacity of a country to deal with the impact depends on the strength of its health systems. That's true for us. That's true for our partner countries. And so investing more in the strength of health systems is fundamental. That's first line impact. That's obviously also what defines subsequently the capacity to actually distribute and administer those vaccines. And we've seen how some of our partners in Africa notably are struggling, really struggling with it. The DRC, Congo, has returned to COVAX 1.3 million doses of the 1.7 received, simply because they could not roll it out. And therefore, no response is complete unless we really work on strengthening health readiness. There is work to be done. I mean, if I look at how the health portfolio in the development portfolio is structured, the cake over the past decade has not really increased. There are many other competing priorities. There is climate, there is education, there is energy, and so on. So the cake has remained stable. But what we have seen is how the emergence and the strengthening of global funds, Global Fund AIDS, tuberculosis, malaria, Gavi, and so on, how the cake and the way in which it has been divided has been more and more gone through strengthening these global funds, which of course is the right thing to do. They do need funding, and there is an efficiency linked to that, combined with big mobilizing power at the level of pledging conferences, which is right. But to a certain extent, it has led to a shift of funding within the health portfolio more to these global, let's say, to the global architecture and less to what needs to be done at national level, the strengthening of health systems. And it's one of the things we must take away, is that investing in the global level must be accompanied by stronger investment in the national level. Very clear point, and that there I think the IMF report is very useful. If you look at it not just from a health point of view, but also from an economic point of view, really more money needs to go into it. And therefore, I do hope that the funding demands are not just looking at ODA, unless ODA gets strengthened, but that the ministers of finance may also, through other ways, start injecting more funding in dealing with this. My final point, because I do want to leave space for Q&As and several rounds, but is of course the issue of manufacturing. I think until now, the pharmaceutical industry, which is of course a globally integrated, very much functioned along, let's say, the Adam Smith principles. You allocate it where it's most opportune, you generate the vaccines, and you then distribute them globally. And until now, that worked well. I mean, the 3.5 billion vaccines needed globally on an annual basis to vaccinate children on a global basis, they were produced. It didn't matter where they were produced. They were produced in the most efficient way and then distributed. I think what we've seen with a pandemic like this is that there's a huge risk that when a pandemic hits the globe, and at that point in time you are not ready to produce enough at a global scale, that rather than having a system that allocates it globally to where the immediate needs are, health workers and so on, that a dimension of, let's say, vaccine nationalism kicks in. Probably this means that we need to draw lessons. That's how politics works. And we need to draw lessons that no doubt a global mechanism to manage this better is needed. But I think it will also require us to really increase manufacturing capacity globally for vaccines. And here we are particularly looking at Africa, which is, I mean, importing 99% of its vaccines, 94% of its medicines. That's not normal. That's not normal. And we are really now, we have embarked, and President von der Leyen has announced it in May, on a significant long-term initiative with our African partners and with pharmaceutical companies to start putting in place the building blocks, enabling environment, supply side, demand side, to start creating serious pharma manufacturing capacity in Africa for vaccines, for other essential medicines, and for technologies. If you look at the potential of mRNA, for instance, when it comes to malaria or when it comes to snake bites, we think that there is a case. Of course, we need to make it commercially viable. So apart from the political and moral pressure that now exists, there's obviously a commercial and economic case to be made. But we are quite confident from the work we've been doing with South Africa, with Senegal, with Rwanda, with a number of others, that we can make that case work. And that's for us now a real top priority, so as to get things moving over the next 6 months, 2 years, 5 years, 7 years, looking 360 degrees at enabling environment, regulatory framework, investing in scientific cooperation and so on, looking at the supply side and looking at the demand side. I will stop there.
Thanks a lot, Koen. And when listening to all three of you, I think this issue about the political failure is quite interesting. And also this issue that we say in Sweden that you need to work on the iron when it's hot. Right now there is a recognition that this is a real issue. and therefore perhaps a preparedness to do things that was we were obviously unable to do, as Carl pointed to a couple of years ago. But Carl, with your political experience and your political sense, how do you see it? Do you see that this is going to be the determining moment when there will be a global understanding that there needs to be more than just declarations from meetings and pledges, as Kuhn pointed to some extent, but there is a real need to move in the direction of what Anders pointed to, namely see this as a real global asset, a global good, that we need to have the right political framework in order to be able to handle in the right way for the future?
Well, that's the responsibility of people like us on this particular webinar to make the case with force. And I think we all have been trying to do it. Are we having a sufficient impact? I don't think we are. I'm rather worried at the moment by the sense of slight complacency that I see spreading around in Europe. There's a feeling that things might be over and this might not be the priority and we don't need to allocate the money to this, there's so much else. And that first, I think it will end us into trouble ourselves, sort of 3-6 months down the road. And secondly, it takes away from the necessity of really addressing what is happening in the rest of the world. There was a nuance between Anders and myself on this sort of how much you should invest in doing things for the future. I don't disagree, Anders, with anything of what you and Cohen said, but my concern has been, that's coming up from discussions prior to the G20 Health Summit and the G7 Summit. If we try to get one sentence into the conclusions, in the summit conclusions, saying we are ready to give the money that is needed to win this war, I mean, we didn't succeed to get that sentence in. But there was a readiness by all sorts of bureaucrats from all sorts of countries to have endless text chunks on reviews and preparedness and future and blah, blah, blah. I'm all in favor of winning the next war. We must do that. But I would also concentrate somewhat on not losing this particular war. And as long as the pandemic is spreading somewhere, wherever, risk of new variations is there, and it could unravel everything that we think that we have achieved so far. So, I mean, that's Christian, the political me. I need, in the policy environment at the moment in Europe, we need both these long-term commitments, absolutely, but not divert from the urgency of the present process. As was pointed out, we have different commitments, but as said, meeting those commitments is another. I think all of us have been involved in pledging conferences on the global level, and we know that there's an amount of double accounting and less serious accounting. And for example, on the vaccine sharing, we've seen commitments, not enough in my opinion, but we don't see the deliveries. I mean, COVAX, I spent an hour this morning discussing what we do with COVAX. We don't have sufficient vaccines to meet the commitments that are there, and those commitments to the different countries. And those are fairly low anyhow. And that sense of urgency must be there in the European debate at the moment. At the same time, as most certainly, we need to prepare for these long-term issues. As said, this is not the last coronavirus mankind will be confronted with.
And I would suggest also that there's a need to bring it up in the national debate. It's quite striking in Sweden how much we focus on the situation in individual counties, whereas the discussion about the situation outside Europe is fairly limited. Anders, you mentioned vaccine nationalism as well. Perhaps comment on what has been said, but also if you might say 2 words about that. If it's growing, it's something we have to have a close eye on.
First, very practically, this idea that you can't share anything before you have basically immunized everyone in your own country. Of course you can. It takes time to negotiate with the vaccine companies. So, I mean, if we could have an agreement now that it should be shared, this is how much Sweden will share. Sweden has more than 3 million doses to share. The European countries have billions of doses to share. but just have an agreement. You don't need actually to transport it, because it will take at least 2, 3, 4 months before you've done all the paperwork and it can start moving. But if you wait until you're done your 70% before you even start that work, then we will lose another 3, 4 months, and it needs to move now. So I think there's a lot of practical things we can do now if we can get that political commitment. And I think that political commitment is the problem, the nationalism, that this time, compared to when we had the Ebola outbreak and when we had the SARS outbreak, this is, as I said, hitting both low and middle income countries and high income countries even more. And that's the issue. That's the political issue. And that's why we need also to now begin to take that step, that mind shift, to move into that we have global threats and we need global solutions. We need global agreements in terms of how we're going to deal with this. And we can't just have them and us, as we have had in the past when it comes to global health. I've been working on global health now for 30 years. We need to go to a different paradigm. And this is what we're living now. Because we can't divide that the self-financing countries that are part of COVAX, they will deal with their own business. And then you have the other countries and the Gavi takes care of them. It doesn't work. Because it's the same pool of money, same pool of doses that you need to deal with. So that is what, in some way, WHO has failed when it comes to setting up what they call the allocation mechanism. So we need to, both in terms of the system, a platform, research, fine, that is working excellent today, to share the genetic sequences, information, getting that to production, but then the production, the access, the distribution, and using then what is best from a public health perspective to stop the pandemic, that is missing. And that you need political agreement on, that this is actually best, not just for your own country, but for the world.
Cool. One element that was mentioned here, which might help in order to get the right framework for what Anders and Carl is pointing to, is the economy. Obviously, according to IMF, this is the major threat towards the global economy. Is that something that you feel is well taken into account in the framework where you are sitting? Is this something which is on the minds of the heads of states and governments when they are meeting at the European Council, for instance, last week?
Well, I think the IMF paper was certainly well done and well timed in the week ahead of the G7 with a very simple, clear and strong message, which is, if you invest now, not tomorrow, not next week, if you invest now $50 billion US, collectively, we win $9 trillion US. But if you then look at what is actually, what is led to, if you read the outcome of the G7 leaders meeting, it hasn't exactly yet filtered through in action. So I think, as so often, the case is made, the understanding is there, but subsequently to walk the talk is always the hardest thing to do. So we will definitely, obviously, use this, use the study as a very strong, political and economic element. But will it be sufficient? That remains to be seen, and that's again in the sphere of politics.
Well, we are starting to run towards the end of this webinar. So, what I would suggest is that all three of you, if you would point to 1, 2, or 3 issues which you consider being the most important here, in order to make people aware, to act on the political side, because it seems to me that on the science side, things are in place, but there are other issues that needs to be addressed. It would be interesting to hear from you. What would you say? What are the 3 main points that, if you would have the opportunity to stand in front of the European Council, for instance, what would you tell them? What are the 3 issues that needs to be on the mind of the leaders in order to move this forward? Carl, are you ready to start on that one?
I don't think I'm ready, but I start anyhow. I would say, the number one thing that we need now is political leadership. I know myself. There's a tendency, if you are prime minister, whatever you are, temptation to give the positive messages, saying, we've done it, we've been good. But I would say the message that political leaders should give now is it ain't over until it's over. And it ain't over, distinctly. It could even get worse if we mess things up. That sort of awareness needs to be communicated to the general public. That affects both what we do in our individual countries in Europe, and it affects the global responsibility that we have, not out of sort of the general tendency we should be nice to those people, but in the pure self-interest. The pure self-interest. If this goes on in Africa, as we have indicated, there could be new variations coming and they will hit us. So the pure self-interest, if nothing else, should drive us in that direction. And then, I mean, very down to earth, we need money, significant amounts of money, although there is income, as IMF has pointed out, at the other end if we do that. And then going back to the sharing of the vaccines that Anders has also pointed at, it is necessary. And I fear that we might be in a situation a couple of months down the road, I won't go into the details, where vaccine nationally starts to increase again, and that will be self-defeating. But political leadership is clearly what is the most urgent need.
Anders?
I mean, I would put three things on my wish list. The first one is also the political leadership, but more tangible than that, to establish a Global Health Threats Council immediately at the heads of state level. Possibly this could be something for Angela Merkel when she steps down to lead this, but really that senior political leaders take responsibility, are prepared to sit around the table together, preferably with some also good representatives from the private sector and civil society, but that there is a collective responsibility at the highest level globally. And we have in the report from the panel a proposed terms of reference and composition and how this should be established. Do it now. Second is to reform WHO. To have a sharper WHO, a more focused WHO with more authority and better financing. And the third one is then to establish a new financial mechanism. Because what we have been speaking about here, Cohen, when you speak about the 3 billion, etc., this is still aid. If we're going to get the 50 billion that IMF is speaking about, we need to go beyond aid. We need to get to IMF, we need to get to Minister of Finance, we need to have a new modality that is no longer aid, but it's about global health security and stability. So a new financing mechanism based on a formula or something, but still moving our mind shift beyond thinking that global health is about development is no longer.
Kuhn?
Well, I would have two messages. I mean, first of all, we must do it. And secondly, we can do it. And I think for the must do it, we've addressed it. There's a health imperative, because unless we get control over the development of this across the globe, variants will keep popping up. And as we've seen at the start of this crisis, when it pops up, even in a province in China, it spreads across the globe. So these variants that develop elsewhere will end up or risk ending up with us as well. So there's a health imperative. There's an economic imperative, the IMF study. There's a moral imperative, and I think that South African President Ramaphosa, who clearly refers to vaccine apartheid, puts his finger on a weak spot. There's a moral imperative. And finally, there's a political imperative, because partners across the globe will not forget for long how we reacted or how we did not react. So for me, there are four big reasons why we must do it. But I would also want to build a positive agenda on what we can do it. Just as we have a global rallying on climate, which started with the Paris Agreement, we will have a COP in Glasgow, where we are building a global agenda on this, rallying partners across the globe to live up to this. And just as we will have one on nature and biodiversity, we should seize this occasion also to do a similar one on health, and really put health, and Anders has said it, it has consequences in terms of how we look at the global architecture, but really use it to build an agenda that we can indeed, like we do for climate, like we do for nature, can put in place something that deals with health as a real global public good.
Thank you all of you, and I think these the final sort of priorities are very helpful to focus minds. And Kuhn, what you just said, I believe perhaps that could be something for the European Union to take initiative to. Why not put it into the State of the Union address in September and then drive it forward in order to land on this approach similar to the climate change approach also on global health. With that, thank you all of you for having taken part in this webinar, and I think we stop here.